Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. I'm Yasmin, and I'm the Member Engagement and Communications Manager at GIG Gulf. We have spoken previously about anxiety and mental health in adults, and we're here to take this very important conversation even further. Today, we're going to talk about mental health in children. ADHD, autism, anxiety, eating disorders. These are all some of the common conditions that children and their parents may be facing. We are here today with Lara Ltaif, clinical psychologist at the American Hospital Dubai, with more than 13 years of working experience in psychoanalytical and CBT training. She has established a department of psychometric assessment in Abu Dhabi to help identify patterns of cognitive strength and weaknesses in patients with acquired brain injuries. Thank you, Lara, for joining us today.
Thank you, Yasmin. I'm glad to be here.
So I've read that 1 in 6 children ages 5 to 16 is diagnosed with a mental health condition. Is that true?
Yeah, mainly, yeah. It's a big number, but yeah, it's mainly true.
Is there something that's more common, like mental health conditions that are more common amongst children, or is it random?
Of course, there is. Mainly in mental health, all the diagnoses for adults are there also for children. But the common mental health diagnoses or mental health problem are ADHD in children, anxiety, autism, and depression. Those are mainly the common ones.
So when we say children's mental health, what does that mean exactly? Is it just about diseases such as anxiety, ADHD, or is it more about the mental well-being of it?
It combines both. It is a disease if you want to take it in the more scientific way, but usually in children, when you have a mental illness, sometimes it's something curable by behavioral approach, nothing that need medication. 90% of the diagnosis in children do not always recommend medication. Yes, medication is there. Yes, there is psychiatry. Yes, they do follow up. But 90% of those issues are mainly behavioral. So you have two things that you have to differentiate. If it's a behavioral issue momentarily, and if it's a mental health issue. When it's a momentary issue, it's for a short period of time and the behavior will change without any intervention. But when things go beyond 2 months, 6 months, then here it's a problem, it's problematic, it's a mental health issue, and then you have to go see a professional psychologist or psychiatrist.
So what are the most common symptoms that can be changes in behavior you mentioned, but what else is there?
There is mainly change in behaviors, withdrawal. Let's say the child could be present with them and then suddenly he starts sitting in his room, not communicating, being more withdrawal, social withdrawal, academic deficiency. He was good in academics and then you start seeing that his academics are going low, behavioral problem, aggressivity, all of this.
At what age have you seen that such conditions start appearing or presenting themselves?
Some conditions start at a very young age, but we cannot officially diagnose before 4 years or 3 years. This is the official age for diagnosis. But mainly, let's say, for example, autism is there since 1 year. You can see it. There is a behavioral problem. There is a miscommunication. The child is not engaging, nor with mother, nor with parents, nor with anyone. You feel he's in his word. Most of parents with children with autism, at the early age, they will suspect that the child doesn't hear. So they will go and check their hearing sound. ADHD is there also at the early age. You see excessive behavior of restlessness. They will tell you, oh, my child is a bit more active than regular children. It could be ADHD, not just only his active, but you cannot really diagnose or put an official diagnosis before 4 to 5 years and a school year.
How can you differentiate if it's just, a child who's naughty or overactive, or if it's something more that, you know, requires a visit to the psychiatrist or psychologist to evaluate?
Usually there is a different thing that we need to check. A naughty child is a child that not all the time will be naughty. He has good days, he has bad days, he has mood swings, and it's there, and it's manageable. It's not stopping his life from moving on. It's not a barrier for him to do things. But when things become a barrier for his life, for his development, then this is the red flag that you have to go see someone. So if things are manageable in life, that's mean it's okay. It's not something very...
It's the character. Yeah, it's just this is the way they are.
Exactly. But when things are difficult in school, the mother or the father or the parents are in constant challenge with the child. The child doesn't really listen at all. He doesn't, socially, he's not really be able to interact. So all of these are alarming signs.
You mentioned autism and that it can be diagnosed from children as young as 1 year old. Does that mean that they're born with it?
Mainly, yes, it's in the genes of the child. So some children are born, but a lot of studies have talked about the connection between the autistic child and his mom. So, for instance, you know, when a mom breastfeed a child as young as that, is few months old, okay, when she breastfeed him, the eye contact she give him while breastfeeding, in the breastfeeding act, this made a connection between the child and the mom, and this is very, very, very crucial. Some autistic children, when you do this with them in a very how do I say it, in a very natural way, yeah, they don't really have a good eye contact from that beginning, from that small age. So it's very crucial for the mom, when she decides to breastfeed or not, even if she's giving a formula, she have to hold the child in a specific way, give him eye contact, show him her presence, that she's here with him. She cannot breastfeed and do something else, watch TV or talk to some parents. I'm a parent and parents do mistakes, but some parents, they could put baby and with the bottle in the crib and then do something else, you know, attend another child or whatever. So this connection at the very early age with the child is very crucial for his mental well-being.
Okay, so that's autism. What about the rest of mental health conditions? So ADHD, for example, is that also something children are born with?
Yeah, mainly, but ADHD, you can see it more when the child is, the concern comes more with ADHD when he starts school. Because from where come the main concern? From school, okay. He's not been able to sit, he's not been able to keep attention for a long period of time, he's not listening, he wants to do things his own way. So all of this, but for me as a psychotherapist, a child with ADHD, I always say this to my client, is a child who has a brain of a Ferrari with a brake of a bicycle. So he is very outgoing, he is very creative, but it's the brake that need to be more worked on. And a lot of children with ADHD, it can their behavior can change when the parents are very much engaged in therapy, when the parents know how to deal with him, when even the teacher know. It's a combination of everything. You know, it's the therapist, the teacher, the parents. Everybody need to be on the same page to help this child develop better. Another thing in ADHD, for also, as I see a lot in clinic, it's a child who doesn't know where his place is. He's searching for his place. He's constantly moving. He's searching for his place. So I help parents to teach that child where is his place in the family. Sometimes this, they don't really pay attention, or they're not listening well, and then you see all of this behavior coming up.
Okay, there's a lot of talk about, you know, if you allow children to watch TV or give them screen time from a very young age, then that could cause ADHD. Is that true?
Not totally true. because it is a condition, like, you know, it's a combination of everything. Watching TV at a very young age, we don't, first of all, we don't recommend to watch TV before the age of 3 years old.
Okay.
For the brain cells, for the development of the brain, for a lot of things. But watching TV at a young age as that, it's one of lots of other factors related to that. It could be, yani, it helps too if the child is already predisposed to be ADHD, then it's one factor that will help more.
So it adds to
It adds to it, but
but
alone,
you can't
no.
cause it
No,
from
no, of
scratch.
course not, no.
Okay, from your experience, do you find that family life, like the relationship between parents, the relationship between siblings, does that impact children's mental health?
Absolutely, because the first thing you see, the first example you see in your life is that couple, your dad and your mom. This is the first example of relationship you see, and then what do you see at the home, in the home environments, is something that will help you to go out there and seek for it. So let's say, I will give you an example, a mother and a father who always fight, who always criticize each other, who always, they do not have proper communication between them, they don't listen to children. This will impact on the child. So he will be more like, or he will be a bullier and criticize everybody else when he gets the chance, or he will be accepting for bullying. He will be introvert, he will be shy, he will be, he will take the people pleaser, he will take all of that aspect. Low self-esteem, he will take all of that aspect. So the family environment is the first thing that you are exposed to in childhood, and it's the first example. And usually children that have mental issues and they are not treated, it continue on to adulthood. It doesn't stop there.
Okay, you mentioned medication for ADHD, but what are some other treatment options? Like if a child is diagnosed with a mental health conditions, do they necessarily have to take medication, or is it one of the options, or does it depend on the condition?
Medication is not always the solution for a mental problem, especially in childhood, because mainly of them, they are, as I told you before, they are behavioral. So the other alternative, if the psychiatrist will see that, okay, no, we're not going for a medication, let's go for alternative, it would be a cognitive behavioral therapy. It could be a play therapy, especially with young children, a talk therapy, all of these type of therapy that work on behavior, work on concentration. Also, it can work on relationship, on social interaction, on all of that.
Okay, we always hear that children are more resilient than adults. In your experience, do you find that children who are diagnosed with specific mental health conditions, like an anxiety, for example, are they able to manage it better than adults because, you know, they've realized it from a young age, so they're able to sort of train themselves to deal with it?
If they are treated, yes, and if they did the proper therapy for it, yes. But if they did not treat it, no, it will, in adulthood, it can be a risk for drug abuse, if not treated at a young age. The younger you treat, the more resilient that person will be. But if you don't treat it and you leave it there, it can become even worse in adulthood. So, like, for example, you said for anxiety, children with anxiety, how do they express it? They express it by pain in the stomach, by a lot of question. Why this? Why that? What if? What? You know? So these are signs of a child is anxious. He's afraid to leave his mom. He's afraid to be by himself. He doesn't have this independency. So we need to be aware of the red flags in a child behavior, so we know if we need to get a proper help by professionals or not.
Okay, since a lot of the responsibility falls with the parents to, you know, notice the signs and see if their behavior, is it normal, is it not normal, because, you know, the child is not there yet to, they can't decide that, okay, I need help, and they would go seek it. What are some resources that parents can utilize or can use to help them understand their children's conditions or behaviors?
They can read, they can go online, they can ask, they can come even to a specialist to just ask, not just to educate themselves, you know. And the more we do awareness about that, the more parents are aware about what to see in a child, when to get alarm or try to understand what's happening by educating themselves, by reading, by going online, searching, research. All of these things could help parents more understand. Asking the teacher sometimes, asking how's the behavior of my child in school environment, because it's different from the home environment where it's safe. So parents have a lot of resources, and nowadays everything is accessible to everybody.
You said to know the signs, or to like identify that, okay, this is alarming, so I need to do something about it. What is the red flag that, if a parent sees in their child, then they should immediately seek professional help?
First of all, change in behavior, change in appetite or sleep pattern, or extra eating or less eating, sleeping more or less, change in social interaction, and change in academic performance. So those big change, you will really see a difference. It's not a minimal difference, like he has 18 on his test and he has 17 now, then no. It's a big difference, it's a drop. So those are the main thing that we need to always be alarmed about it.
From your experience, if a child has been diagnosed with a mental health conditions, does that impact their future?
It impacts their future if it's not treated, yes, because he will carry it on, and it will maybe be a risk for drug abuse, alcohol abuse, bad relationships. So yes, but if it's treated, it shouldn't impact their future. Sometimes some mental health problems are treated within 1 to 2 years of therapy and good containment, even 6 months. So when you treat it, done, it's finished. He can continue his life, and he know how to cope with it. He have the tool how to cope with it.
Okay, so let's get a little bit more specific. What are conditions that can easily be treated within 2 years, as you mentioned, and what are conditions that are lifelong? I imagine something like autism, that's something that's, that's
yeah, exactly. Like autism, something is lifelong, but you can minimize the symptoms that you see. If you work very well on the behavior, so you will be able at the adulthood to see there's something, but you will not know what. If it's well treated, if he did the correct therapy, if he did the correct pathway, yes, you will minimize the symptoms. Let's say anxiety could be treated. It can finish there and done. But he will be at risk a little bit more to be more anxious than other people. Okay. Depression also could be treated easily. ADHD, he could manage his symptom as well. He could cope with it. He will always be active and a bit different, and he cannot keep concentration.
Energetic, very
energetic, and he cannot keep concentration for a long period of time, jumping from one task to another. He will always be like that, but he will be able to cope with it better. He will know how to twiddle things around.
Okay. One last question. What is your advice to parents generally, and what is your advice to parents who have children diagnosed with mental health conditions?
My advice to parents generally is do not criticize. Always create that safe environment where the child can come and talk to you. Listen. When the child is there, he needs something, listen to him. Give him that opportunity to talk. Give him that feeling that I am safe, I can talk to you, I can come to you. Be more caring. Express love. Teach children how to express their feeling. It's not something taboo for a child to express, to say, I'm sad, I'm happy, I'm excited. expression of feeling, teach them this from a very young age. For parents with children with difficulties, I would say accept. First, the healing comes when the parents accept that their child have a difficulty. And after this acceptance, we start moving on. Because, you know, when there is a difficulty, especially with a child, it's very difficult for parents not to deny. It's a mechanism that we all do. It's a denial. So it starts with denial. And when they reach the acceptance, at this moment, those parents are ready to help the child and improve him and let him lead a better life in the future.
Thank you very much, Lara, for being with us today. This was very enlightening. And to everyone listening, I hope we helped you shed some light on this very delicate yet important topic. In our upcoming episode, we were going to talk about how to focus on yourself and achieve work-life balance. Make sure to tune in. We're available on YouTube, Spotify, Apple Podcast, and Anghami. Stay well and keep thriving.